Hi everyone, and welcome back to my channel. My name is Esli if you're new here, and I have another pregnancy update for y'all. This is not the pregnancy update that I was thinking I was gonna be filming. I'm like already gonna start crying. I'm gonna do my best, but it's been a really rough few weeks. But I had like my whole calendar set up so that I would be doing an update. I believe it was for weeks 17 and 18. But I am now, today I'm actually 21 weeks pregnant, so this is actually going to be from 17 through 20. And I'll get into, you know, why there's some changes here. Odin is here next to me. If you see a little head sticking up, he is very, 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 very extra attached to me right now, and I think he just knows what is going on. And also, he hasn't been in my room as much. He's very rowdy. Like right now he's, you know, just napping, but if y'all, you know, have seen other videos or if you see him on Instagram, he tends to be a pretty rowdy dog, and he tends to jump all over me. And just with the situation, I have to kind of keep him away for the most part. So he hasn't been allowed in our bedroom. And so anytime that I'm out here in our living room, he is just like stuck to me like glue. So anyway, that's just him. Luna's right here also, but she's by my feet. She's curled up by my feet. But anyway, so I have like my notes here, and from when I was gonna film that 17 and 18 week update. So starting off with that, I actually went to the emergency room on May 7th. I'm looking at my calendar here to try to keep some of the dates, you know, because it's just been a lot. I had some really bad chest pains. If you saw my vlog, I will link that up above. I had some really bad chest pains. I thought there was a heart issue. And it turned out it was really, really bad anxiety. It was like a panic attack. I was totally fine that day. I do suffer from anxiety, so I know that sometimes there isn't a trigger. Sometimes, you know, it's a medical condition. I know that not everybody deals with that, and maybe not necessarily can kind of understand it very well, but there wasn't, like, I was perfectly fine. There was no specific trigger that day. Now looking back on that vlog, you can tell that I was basically on edge. It had just been a lot of little things, you know, like a lot of things building up, and I think that maybe it, you know, it was just kind of the culmination of a lot of things. And I went to the emergency room. I was there for several hours. It was really tough because they were concerned that I could have a blood clot because I'm pregnant. They're more common during pregnancy, and you know, they wanted to check. Now in my legs, it was safe for them to check because they do basically like an ultrasound, like the same, you know, that they do on your belly when you're pregnant, but they do it all through your legs and into your groin area to see if you have any blood clots. Now that came back, it was totally fine. And then the next step was to check my chest. Now the only way to check my chest was through x-ray. And there are obviously some risks for baby girl. I'm having a girl, if you didn't know. And that was really tough because I was in the emergency room by myself. They don't allow anybody in there with you right now because of the virus. And I was in there completely alone, and I have to make this decision of, do I want them to take an x-ray? I was covered. They put, you know, that thing on me to cover my belly. I talked to my mom on the phone. It was like 3 o'clock in the morning. I talked to my mom on the phone. I obviously talked to my husband on the phone, and they said, you know what, like the risk of the x-ray is so small compared to the risk of if you do have a blood clot. You know, you can't take that risk. You have to make sure that it's not a blood clot. So they did a bunch of tests. They did, I think they're called EKGs. I was hooked up to like a million monitors. Everything was fine. My heart was totally fine. Everything came back great. It was just really bad anxiety, basically. So we went home. That weekend was actually Mother's Day weekend. Because of the whole quarantining thing, we decided not to go visit our moms. So it was my first kind of weekend, my first Mother's Day, you know, unofficial, or I don't know, you know, it's kind of strange to celebrate right now, but that day I actually felt baby girl move for the very first time, and that was just amazing. That was like the best gift that baby girl could have given me. She moved, and I definitely knew it was her. I know I'd mentioned in my last update that I had felt like a little bit of tapping, and I don't think that was it. I think that must have just been like, I don't know, a big dinner or something, because this was a definite, it almost felt like a little swipey zap. I don't even know how to explain it properly. I feel like if you are a mama, you totally understand. If you have never felt that, then you probably it's honestly a feeling that I cannot describe. Like, there's no way to describe it. Now I feel her every day, constantly, in the morning, late in the evening, during the day. Like, she's just moving around all day long. She's definitely wiggling around in there most of the time. It's wonderful. It's feeling her is such a wonderful reminder that she's like in there, and for now she's okay, that I wouldn't trade it for anything. So that whole week passed. The only thing I had in my notes for that week that I wanted to mention was that I was feeling some really strong pain in my tailbone, so much so that I could barely even sit. But I Googled it, and said it was normal. I didn't think anything was wrong. I still don't know if it has anything to do with like what ended up being wrong, but I feel like I wanted to mention it because, I think that really made me think, like, you can't be just Googling and doing your research. Like, you really should have just called your doctor just in case, because that's what your doctor's there for. And I obviously I can't go back, and I'm not like beating myself up about it, but I do wish that I would have kind of stopped trying to research on my own and just ask my doctor, because I don't know, maybe they would have said like, hey, we want to see you a little bit sooner, and maybe I would have had my surgery sooner, which would give us a better chance. But anyway, on Monday the 18th, I had a sonogram appointment. I was 18 weeks there, 18 weeks in just a few days, and it was kind of like my 20-week scan. So I know most women have theirs at 20 weeks. I was having mine a little bit early because I am immunocompromised. I was gonna go see a specialist anyway, so they wanted to kind of get that done a little bit early. So I go in, and it's like I was so excited. I couldn't sleep the previous night because I was just like, oh, I get to see my baby tomorrow. I get to see my baby tomorrow. Like, sonograms are just like the greatest thing. So go in there, and the sonogram technician, she's like looking at my belly, like she was, like they're kind of going around trying to measure baby. Baby girl was being a pain. She was not letting them like scan her properly. She kept wiggling. Like, as soon as they would get her on one side, she would just like swim across to the other side of my belly. She was like not having it. It was really cute though, because probably took like an hour, and I was just watching baby girl like move around in there for probably almost an hour, so it was great. And the girl was like super chatty with me and being like, oh, like, here's your little feed, and here's this, and here's that, like everything. And then it went time, or like that passed, and it was time to do a check on my cervix. So that one is an internal sonogram, and so we prepped for that. We got ready, and as soon as the image popped up, her face changed. Like, her face changed immediately, and I knew something was wrong. Like, I just knew in my gut that there was something wrong because of her demeanor, her expression. Because she went from being like super like, like baby this, baby that, like, oh, what are you naming her, and like all these things, to like stone faced. And I asked her, I was like, is there something weird? And she paused for a little bit, and she said, oh, I'm sorry, I'm just trying to concentrate. So she like just cut me off. And I know that they're not allowed to tell you anything. I know that, they just have to give their findings to the doctor, and the doctor is supposed to give you the result. So I didn't want to put like pressure on her to be like, what's wrong? So I just stayed quiet, and I just baby girl's moving. I just stayed quiet, and I just kind of waited it out, and you know, she left. She's like, okay, go ahead and get dressed, the doctor will be in here in a moment. So I got cleaned up and dressed, and I'm sitting there, and I grabbed my phone and I started texting my husband. He was outside waiting, poor thing. Like, he's not even allowed like in the lobby or anything. He's sitting in the car waiting. And I text my husband, and I text, I think there's something wrong with my cervix. I think that they just found something wrong, but the doctor's gonna be in here. But I didn't send it, I deleted it. And I was like, no, Esli, like, stop, you're probably, you know, it's probably in your head, like, stop thinking that something is wrong. You know, there's probably nothing wrong, it's gonna be fine. And so I deleted the text message, and I sat there for, I don't know, maybe 5 minutes. And the doctor came in, and it was the worst day of my life. So the doctor came in. I'm sorry. Like I said, I'm trying to cry, but it was truly like the worst moments I've ever experienced. So he came in and he said, baby looks great, but your cervix is failing. He just said, you have maybe 6 weeks tops until you have a miscarriage. And he said, I'm sorry, I'm so sorry to have to tell you this, but you're not, like, this pregnancy's not gonna go to term. You're not gonna have this baby. And I said, what can I do? What do you mean? Like, is there anything? And he's like, well, we can try some progesterone, but it doesn't usually work. We can try a surgery, but it doesn't usually work. Like, he just gave me no hope. None. I'm sorry, y'all. He just completely said, nope, like, your cervix is failing. He said it's called an incompetent cervix. Your cervix is just funneling out, and he literally said, like, you're gonna start bleeding, you might start having contractions, sometimes the baby just falls out. Like, he literally just said these things, like, just like that. And I'm sitting there alone, like I mentioned, my husband's sitting in the car. And he gave me a few other explanations of, you know, what it is. And he walked to the door and said, you know, take a few minutes and then just, you know, go check out at the front desk. So I sat there just hysterically crying. And I called Luis, my husband, and like I said, he was outside in the car, and he started crying hysterically too. And I just told him, like, look, I'll be right out. I'm gonna try to just leave as quickly as I can here. And I go to the front desk, and they're like, oh, you know, I make my copay payment, and then they're like, oh, actually, we forgot to draw blood, so can you go back in there? And so I'm sitting there crying and crying, and they're taking my blood, and I'm, you know, answering questions, and I just wanted to be with my husband. I just wanted to get out of there. And so I get to the car, and, you know, he just hugs me, and we're crying and crying. And he said, like, you know, by the time I got to the car, Luis was angry. He was so angry. And he, not at me obviously, but like just frustrated. And he was saying, like, no, like, we'll go to other doctors, we'll figure something out. Like, there has to be, you know, because there has to be other options. Because baby girl's fine. She's perfectly fine. So I sat there and I called my mom. She didn't answer. I called my baby sister. She's not a baby. She's almost 20. I called my younger sister. She didn't answer. I called my older sister and she answered. I called my dad. I called everybody, and the only one that answered was my older sister. And I mean, it was Monday in the middle of the, it was like mid-morning. It was, I don't know, I think it was like maybe 10 or 11 at this point in the morning. And I told my sister, and you know, she started crying, and I think she ended up calling my mom. Like, she ended up getting a hold of my mom. I don't even know. It was a blur. But as we're sitting there, you know, Luis and I crying and trying to talk to our families and things, my doctor, my OB, gives me a call, and she's like, hey, I just heard from Dr. such and such about your appointment. And you know, she could tell I was crying. She was like, don't cry, girl, don't cry. We can try, like, we can try. She said we could try, you know. My cervix is really short. Like, this is what she was, or what I was told. So my cervix is really short, which is why I guess the other doctor didn't think that the surgery would even work. I was measuring at about 1 centimeter. And my doctor, she was so sweet and so kind, and you know, she gave us hope again, because at that point we just felt hopeless. And I'm sorry I'm crying, y'all. I know that's like annoying whiny voice is not fun to listen to, but it was a really tough day. Okay, I'm gonna try to control myself. So she said, you know, we can try the surgery, like I'll get you in tomorrow. And she's so sweet. She said, you know, because she was having surgery, like apparently Tuesdays is like her surgery day anyway. And she said, I'll get you in like first thing in the morning. She's like, if for some reason like her schedule was just super booked, she said she had to talk to like her scheduler. She said, you know, I'll do it on my lunch break on Wednesday, you know, just we'll do it like as soon as possible. So later that day I get a call from like her office, and they say like, okay, like we have an opening tomorrow. I think I went in like at 8 a.m. or 7 a.m. I don't even know. We got there super early. I think we left the house like around 5:30 in the morning, because we had to be there a couple of hours early. They did have to do like the COVID-19 test and like blood work and all these things. So we got to the hospital. I mean, that night we were just told basically like stay in bed, like don't move, try to make the least amount of effort as possible, and you know, get to the hospital as soon as possible, and so on and so forth. So we get to the hospital. Luis was allowed in there with me, thank God. Obviously he couldn't go into the operating room, but he was able to wait in the room that like they had assigned to me, which I was so grateful for, because that would have been a lot harder had he not been allowed in. But he was in there with me, and the surgery was super fast. You know, they took me into this room. I have never had a surgery before. This was my first surgery. So I didn't even know, like, operating room just totally looks like what you see in the movies, like with those big lights, and there's like a bunch of people in there like rummaging and through things and getting things ready. They gave me, I think it's called a spinal. So it's almost like an epidural, but it doesn't last as long. They gave me that. I remember they put something else, like, I didn't go completely under, it was just a spinal, but whatever other medication they get me, like, knocked me out. I remember feeling them, like wiping me down there, and then I went numb and I went to sleep, and I woke up however long later. Like, it was from what they told me, the surgery only lasted like maybe 10 minutes, 15 minutes. It was a really fast procedure. So what they did is they closed up my cervix. My cervix, I'm still funneling down. The bag is funneling into my bag that's holding baby, is funneling into my cervix. Basically, my water could break at any moment. But they put a stitch around it to prevent, you know, that from happening as easily. And that's all they can do, basically. That's the best they can do. And surgery went well. She said that my cervix was so far gone, basically, that she could actually see like the bag, like the amniotic sac. I don't know what the names are. I'm bad at this, obviously, but she literally could already see my baby, basically. There was a lot of other things in there, like membrane, or I'm not sure. Y'all, I was half asleep. Like, I was so doped up that I don't even remember exactly what was happening. But I remember her telling me that, like, that it was really bad, basically, but she was able to just like close it up as close that she could get to, or like as high up as she could get. I had a follow-up a week after that, and they said I was now measuring at 1.4 centimeters, which is still not great, but it's, you know, better than where I started. And the cervix, my cervix has or the stitch that they put in is holding. So it's called the cerclage. I had never even heard of this. Luis immediately, you know, once they told us, that's just how he is. He immediately does a bunch of research, and the odds are decent, you know, and we'll take it. I mean, even if they had told us 1% chance, we would have done it, because obviously we want our baby. Oh my goodness, this is a lot harder than I thought it was going to be. We want our baby, so that's all that matters to us. And I, like I said, how my follow-up, everything looked good there. Baby's still doing great. She's growing, getting bigger. And we just have to wait. It's day by day right now. It's day by day. And we are praying. We are praying and begging God that he allows us to keep this baby, and that I can at least get to a place where it's safe for her to be born. You know, first goal is 24 weeks. That week is what they consider viability. So that is when baby has a higher chance, like higher percentage of being, you know, that she would be okay after birth. So I'm 21 weeks today. Every Friday is my favorite, you know, Fridays are my new favorite day, because that's my flip day. Today it's Friday and I am 21 weeks, so just have to make it 3 more weeks until, you know, baby is considered viable, as they say. And, you know, then from there it's just kind of every day is just a little goal. So I'm going in to see my doctor and that specialist, that doctor that I now like hate. Like, I can't even look him in the face. Like, last time I saw him, I just honestly like wanted to punch him. And I understand. I know that doctors, you know, they can't give you promises, and they can't, but that was just, it was awful. It was awful to not give any, you know, not give us any hope. Was awful. To tell me this little baby you're feeling in your belly is just not, you're just gonna lose it, like it's just gonna fall out, like literally just say that. That was awful. That was really hard, y'all. But I have appointments pretty much sometimes they're every other week, other times they're every week, like just kind of depending on what I have to go in for, but they're pretty frequent. And we just have to keep hoping and praying the baby girl stays put and stays in there. I did have to go back to the emergency room. When was it last? I don't think I wrote that one down, but that one was just a few days ago. I had a lot of pressure. This was after my checkup, after I'm told, you know, that my cervix looks good, and not good as in great, but like that the surgery went well, and the stitches holding and all of that. I felt some really strong pressure, like vaginal pressure, and so I called my doctor's office, and the like doctor on call, it was the weekend, so the doctor on call just said like, hey, we can't take any chances, you know, like what you're feeling is probably normal, but we can't take any chances because you had the emergency cerclage. You need to go into the emergency room right now. So went back to the emergency room. That was just last Sunday, and you know, they checked me. I'm not leaking any fluid. Baby girl looks great. She's measuring exactly to her date, like she's measuring perfect. Everything was fine. So as of right now, everything is good. Like I said, we're just taking it one day at a time, and every time, like every day, wake up and just say thank you, God, you know, I'm one day closer to being in a place where I think I'll feel a little better, at least when we reach 24 weeks. Like I feel like at least I'll be able to breathe a little, because right now I feel like I can't. How could I, you know, I feel like my baby girl's in danger, and the awful part is that it's me, you know, like it's not even her. She's fine, but my body's failing her, and that's really hard to deal with. But you know, we're doing our best. I am on modified bed rest, which means I need to wrap this up because I need to go lay back down. I am allowed to sit for short periods of time, walk for short periods of time. They told me, you know, you can putter around the house for a little bit, but I can't lift anything. I can't bend down. I can't do anything. And that is so frustrating to me because I am not one, like, it's just frustrating. It's like I've lost all my independence, you know, like my mom has been here. She actually just left today, but my mom has been here, you know, was with us since the day of my surgery. My mom ended up coming. I mean, how could she not, you know? She just, I feel like we just forgot about the virus. I mean, she's been at home anyway, but obviously Luis goes out to work, so it's still a risk to her. But she's been here taking care of me, taking really good care of me, making me amazing breakfasts in the morning and dinners every night. And she's been packing Luis's lunch. I mean, she's just been wonderful. Luis's family actually gets here today, and his mom's gonna stay with us for a little while, his sister and his mom. So they're gonna take turns because I can't be by myself, basically. Luis is an angel sent from heaven, y'all. Like, both my mom and Luis have just been angels. Like, Luis has been doing everything from helping me go to the restroom to helping me shower. I mean, now I'm obviously right after the surgery was a lot harder. I was in pain. You can't take any pain medication, so that was tough. But now I can get up by myself, like out of bed. For a while there I couldn't, but we actually purchased this thing on Amazon. It's like a little like pool ladder, so he tied that to the end of the bed and I can pull myself up with that. That way I'm not putting any pressure on my belly. All right, y'all, the camera cut me off, of course, so I need to wrap this up. But I was saying we got one of those tables to go over the bed, and I can do some computer work there. I can have my meals there. I can, you know. But I've been in bed. I've been in bed this whole time, and I'm going to be in bed for the rest of this pregnancy. And Luis tells me, hey, you know what, we were already in quarantine, so at least it's happening at a time where we couldn't go out anyway. So, you know, trying to look at it on the bright side. I haven't had any more issues with pain or anything ever since that trip to the emergency room. I've been feeling good. I've been feeling okay. I don't know what else to say about pregnancy. I wanted to come on here and be like, oh, I've been craving this or that. Oh, sorry. That's an alarm. I've been craving this or that and, you know, this for baby or whatever, but pregnancy is definitely not what I thought it was going to be. Starting off with the whole quarantine thing, you know, that was like scary, terrifying, and Luis not being able to go to my appointment and, you know, all these like little things. And now to this, I mean, it's been not at all what I had in mind, what I expected. But I'm so grateful that she's still in there and that she's still okay. And that's all I can ask for. That's truly all I can ask for. Only thing else I can ask for is y'all's prayers. Please pray for us if you think of us. We're in need of prayers. It's been really hard for me emotionally. I mean, I already wasn't doing so great, so it's just been tough, y'all. It's been really tough, but doing everything I can for baby girl. Doing what I can. But anyway, I need to go lay back down, so I'm gonna wrap this up. I want to thank you all so much. If you follow me on Instagram, then you already knew at least most of this or some of this, and I know that so many of y'all are praying for us and just wishing us well, and I can't tell y'all how much this means to me. We have so many people praying for us that it's incredible. Like, it is incredible the amount of messages that I have received of people praying for us. My mom like spread it in her like prayer groups at her church, which has now funneled to people, like literally people in Colombia were sending us messages, people in Italy were sending us messages, how they have now their church, their prayer groups praying for us, and it just boggles my mind that there's so much love for this baby. So thank you guys so much for that. Anyway, I really need to go lay down. Thank you so much for watching. I am gonna try to do an update, pregnancy update, maybe every 3-4 weeks, you know, maybe just once a month. I don't know. I do want to keep making them. I obviously, like I said, I can't sit down for some time, so I want to keep making these videos, but it's just, you know, we'll see what happens. I don't even want to say like, oh, I want to do this or that anymore, because it really is just one day at a time right now, but we'll see. Y'all will definitely still keep hearing from me. Follow me on Instagram if you don't already. The link is always down below. It's at inkeesli. That's my personal Instagram, and that's where I'll be sharing updates, and you know, that's kind of like first to know, first to get the information there. But anyway, thank you all again. Take care of yourselves. I'll talk to y'all very soon, I hope. Bye, everyone.